Good afternoon, Mitchell County. This is Robbie Dewberry, Mitchell County Hospital District CEO, and I've got Dr. Dee Roach, our Chief of Staff, here with me. Wanted to bring the public up to date. We did receive 300 doses of the Moderna vaccine today and implemented our vaccination process. As recommended by CDC and the state of Texas, we're going through our frontline staff first, everybody that does patient care. Then we're going to be moving on to our nursing home residents, and then also to the first responders in the community. And there's a tiered system that CDC and the state of Texas has given us to follow. And as you fall into that category, we will be vaccinating those if we have doses left. We do have 250 employees here at the hospital district. And so we're going to be giving out as many as we possibly can to those to make sure that we're here to take care of the members of our community. With that said, I did want to go over, we do want you, if you would like to be vaccinated, to call our hotline, which is at 325-728-3431, extension 7070, and we're going to have multiple people answering that helpline. And we'll be taking down your name, some pertinent information, and putting you on the list to be able to be contacted if we have doses left over. Dr. Roach in a minute is going to go over some of the things that you should consider before calling in. But we just want you to be aware, we don't know how many we're going to have left, if any, and what our process is. Dr. Roach and I both were among the first 11 doses that we have given today to receive it, and we wanted the public to be aware. So at this point, I'm going to turn it over to Dr. Roach.
So as Robbie mentioned, we will be administering this vaccine based on a tiered or prioritized system based on pre-existing health conditions or likelihood or probability that you would have a bad outcome if you did in fact acquire COVID-19. So when you do call to the hotline, you should expect a number of questions from those people that are interviewing you. Obviously, the demographic information such as your age, date of birth, those kinds of things. Potential medication allergies will be important. But most important, you want to make sure that you express any underlying health conditions that you might have that would potentially raise your priority level or acuity level somewhat, so that you would be in line for the vaccine perhaps sooner than some of the other people. It could be a good idea that you have a list of your routine medications available to you so that you can offer that information to the people as well. And once we compile this data and have more vaccine available to the public, we'll be notifying you and scheduling you a time to come in and get your vaccine. We do feel it's important for as many people as possible to have access to the vaccine, and so we are again in the process of administering the vaccine to our first line healthcare providers and then prioritizing downward. So call into the hotline, let us have all the pertinent information necessary, and we'll try to get everybody vaccinated just as quickly as we can.
Yeah, and as a follow-up to that, I do want to let everybody know we did receive the 300 doses. There's lots of facilities in Texas, whether it be hospitals, nursing homes, pharmacies, different folks, different places like that have also put in an application to receive the vaccine. With that said, there is a limited number of doses that are being shipped to Texas, but one of the things, because we've got the application process in place, as soon as there is additional allotments of vaccine, we're already on that list. So as soon as we receive more doses, we will let you guys know. I want to keep you as up to date as we possibly can and appreciate the community support. I know this is positive information, and then in some instances not so positive, because we're not going to be able to give it to everyone that we would like to or everyone that's going to want it, but we're following the guidelines that have been issued to us. So appreciate you taking the time to take a look at this afternoon, and we'll keep you up to date as much as possible in the near future. Thank you.
Thank you.